Hey class, this is CRJS371 Pathology of Death Investigation. Actually, in this video lecture, because my notes are fairly short, I am going to address Chapter 4, which is Time of Death, as well as Chapter 5, which is the autopsy procedure. With Chapter 4, some of the things that I want you to take away from Time of Death is knowing that with death, there can be multiple body mechanisms that fail and cause various body changes. And this that are used to estimate PMI or post-mortem interval, also referenced as time of death. The positioning of the body. The chapter discusses the physiology of these body changes and how these changes can be utilized in death investigation. There are several things that take place with determining time of death and factors that should be definitely considered that can also affect it. It's not an accurate, it's more so of a range, that occurs to act as an investigative tool to those to the death investigator, to law enforcement, in helping determine and answer. In this chapter, again, the various physiologic changes that occur within the body during and after death are discussed. These changes proceed through a progression of changes that can be used to estimate the time of death. Now, these parameters are only an estimate, okay? So definitely keep that in mind when we're discussing time of death. And they're very highly dependent on the temperature of the body, ambient temperature in the air, body habitat, and other various environmental factors. Was the body submerged in water? Was it buried underground? What was the temperature inside the home versus the temperature outside the home? How much did the person weigh? The assessment factors each follow kind of a continuum that needs to be recorded by the investigator prior to the body even being removed from the death site. When taken as a whole, these values and investigative information are used to make the best time determination in a death that was unwitnessed, because unless somebody was there and saw the person collapse to be able to say, yes, this person fell out at 9:17, then all we're going to have to do is use the factors and the information around us in the scene to help us better come up with a estimated time of death. Various investigative observations may be helpful to add more information concerning the postmortem interval, as well as the decedent's lifestyle. We might have to collect insects or plants, and photographs were definitely going to be necessary in some cases to aid in this determination. All right, so that is Chapter 4. As far as Chapter 5 is concerned, this is the chapter, of course, with my background, this is probably my favorite chapter, and as well as this is my favorite course of that I teach. With this course, it's usually around this part that I generally like to have you witness or view an actual autopsy. And because of the circumstances that we're dealing with right now, we're unable to do that. However, I do have a video that I am posting for your review exactly for this chapter. And with Chapter 5, with chapter 5, we're going to outline some of the different personal protective equipment that items that is used in death investigation and associate them with the purpose they serve to protect not only you as the investigator, but also the evidence that's being collected. We're going to compare and contrast the Vitro and Rokitansky evisceration techniques and discuss more so the advantages of those. We're going to recognize the various sites to obtain blood for toxicology, and again discuss the advantages and disadvantages of each. Demonstrate with a camera photographing an object from a distance, mid-range, as well as close-up views. And talk a lot about the text talks a lot about the photography that is collected during an autopsy. In short, the best autopsies are those where a routine pattern of data collection is obtained and recorded. You want it to be systematic and you want it to be the same every single time so that the pathologist, the forensic pathologist, is not challenged in court, or the technician is not challenged in court as to you doing something different on a case. Why would you do that? So make it the same. By performing each autopsy systematically, again, it allows subtle pathologic changes to be noted easily. Each case may require some special modifications to answer a particular question, but the majority of the data is obtained in a systematic fashion. This chapter also is going to discuss methods of recording data and routine and special procedures for when you have for dissection and also specimen collection. These beginning techniques will serve as a basis to adapt them to a particular case and to answer desired questions for determining cause and manner of death is what the ultimate goal is. All right, that's chapter 5.